In France, there is a law, and all patients have the right to a second opinion from another specialist. Cancer treatment are funded on a national level, but the funding of trial comes from different origins, as well national support, parents association or a pharmaceutical company. In France, the National Cancer Institute has elaborated a rare cancer plan for pediatric and adult patients. There is no specific plan for pediatric patients and for brain tumor. In France, all patients with cancer younger than 50 years of age are included in the National Childhood. From my point of view, there are two priorities. The first is to reduce the time taken national decision on drug.
So EU treatment options are defined by two things. First of all, clinical trials, where people test new ideas and then they're translated into practice. And the UK has a very comprehensive programme of trials for children and young people. There are more for children than there are for the adolescent age group. So yes, we have access to almost all the treatments available in Europe through the trials and guideline development. Individual drugs, however, can sometimes be a problem because of licensing and funding arrangements, and some of those are specific and need to be handled separately. Second opinions, we as clinicians all take opinions when we make our first opinion, because we make a first opinion within a multidisciplinary team where there may well be 8, 10 or 15 people contributing to the decision about the diagnosis and the best treatment. However, if there's any uncertainty, we would actually recommend a second opinion from another institution so that another team can consider the same evidence. And then we would either offer the patient to go and visit that institution or get the opinion in writing so we can then share that with them. So second opinion is good practice. Practice is dependent, I think, on the indications for its use being enshrined in its licensing. If the indications for its use is in a childhood setting and they've got the license for it, then it's very rapid. The UK's got a network of cancer registries which are regional and an overarching national cancer registry, and so we have very high data ascertainment for newly diagnosed patients with cancer, and it's an integral part of being treated. The biggest challenge in neuro-oncology or brain tumour management in the UK is investment and research. The charity and government spending in research last year was I think around 3.5 million in brain tumours. It was 17 million in acute leukemia, and it was 45 million in breast cancer.
Patricia Blanc, I am the president of the association Imagine for Margot. Imagine for Margot was created very recently. My daughter Margot was diagnosed with a brain tumor when she was 13. Obviously, this announcement was a big shock for us. You know, we didn't even know that kids could have cancer, but actually they can. In France, 2,000 kids will have cancer every year and 500 will die. So we looked everywhere to get information on the internet, and we asked for second opinion for doctors from everywhere in the world, in the US, in Europe, even in China. And there was no clinical trial for our daughter in Europe. We finally found one in the US, but it was too late. She couldn't go there and make the trip. And you know, when our daughter finally got the authorization to get the medicine in France, it was too late. Margot was gone. So, you know, from this story, how it had affected us is that really we realized that today in Europe we don't have enough innovative medicine or treatment for kids with a rare tumor. In France we have a rare cancer plan and we have a cancer plan also, but I'm not sure it is, there is really much of fund invested for rare tumor for kids. When Margot was diagnosed, it took 10 days for Margot to be diagnosed, and then the treatment started immediately. We didn't have the impression that we wasted time or anything. It was very quick. What affected us is the lack of innovative treatment. So if I would say what could we prioritize is really the development of new drugs. So this is why we have created this association to help the development of new drugs in Europe for kids. In France and in Europe, it's the ITCC network. We work in partnership with ITCC, it's Innovative Therapy for Children with Cancer. And together, 41 research centers wants to put energy and develop new drugs for kids with cancer. And this is, I believe, a really great initiative, so that we don't have to take our kids in the US and they can be treated in their own country. It's also good that in Europe we can share expertise and have the best people for the right tumour.
My name's Peter Wilkinson, and at the age of 21 I was diagnosed with a cancerous brain tumour called pineoblastoma. I'm from Barnsley, which is in Yorkshire in England, and I now work for a project funded by Teenage Cancer Trust, which is called jimmyteens.tv. So the condition, unfortunately, with brain tumour, it often can, you may be cured, but it can often leave you quite damaged afterwards. So unfortunately I've been left disabled, so the condition has affected me quite greatly after treatment. I now have problems with my spine because the cancer had spread down my spine. I have neuropathy in my hands and feet, which is a nerve condition. I've also had peripheral vision loss to the extent where I'm not allowed to drive. And I have other problems like cognitive behavioural problems with my brain and general brain humanness, that I like to call, after cancer treatment. So daily life's quite a struggle because even though I'm cured from my cancer, I'm still struggling afterwards. And I always, it's like the late effects are quite a struggle after brain tumours, I find. For young people, there wasn't really a lot around it. And for my specific tumour, which was a rare brain tumour, there was very little about my actual tumour. And I did struggle to find information about that. But brain tumour, yes, there was a lot of information. It was called Cancer Backup, and that's through Macmillan. I know that in the UK you are allowed to have a second opinion, and I know that you can have a second opinion. But I think in my case, because I was so late diagnosed, if I'd have had a second opinion, I probably wouldn't have been here. I'm not aware of any rare disease plan for cancer in the UK. I've tried researching since, and I know that there is something on the net, but I was very confused about it. It was quite difficult to find. So if I'm being genuinely honest, no, I couldn't find it. Now, cancer registries in the UK, now I know they exist, but at the time when I was first diagnosed, I was asked questions and I just assumed they were just questions. I didn't actually realise it was a cancer registry. But now that I know it's a cancer registry, yes, I was given the questions for a cancer registry, and I'm now aware of it.